Hi, everyone. Welcome to MedEnt Minutes, the podcast that explores EHR optimization and how practices can excel in value based care. I'm Megan Chapman, the Director of Marketing here at MedEnt, and today we are talking about Thrive. Thrive is an annual healthcare summit that connects physicians, practice administrators, and industry leaders in independent medicine. And I am joined today by Independent Medical Doctors Association Executive Director Terri Dowd, who has helped organize the event for us. And we also have Dr. James Gardner on to speak a little bit about the significance of Thrive for independent practices. So, Terri and Dr. Gardner, thank you so much for being with us today.
Absolutely. Great privilege to be with you, Megan. Thanks for having
Yes,
us.
Thank you for
wonderful.
having us.
Absolutely. So excited to talk about Thrive. So Terri, I'm going to start with you. I just want a little bit of background. How did Thrive come about? And tell me when and where the event is taking place this year.
Thank you so much, Megan. We work with so many private, independent practices that don't have a lot of support through a hospital system or some other network that they might belong to for employment. So our independent practices really have a lot of questions for their, technology, business items, networking with other practices to see what works. And we decided to bring everybody together for the first time last year at the Thrive Healthcare Summit. Most of our private independent practices actually use MedEnt as their software. So we partnered with MedEnt to be able to deliver something that everyone could get something out of and at the same time connect with one of their technologies. So this year, the Thrive Healthcare Summit will be held in Pittsburgh at the Rivers Club downtown again. So we're really excited. It was a great venue last year, and we were just so happy for everyone who was able to attend.
Oh, fantastic. And Dr. Gardner, I want to make sure that I get a little bit of your background here as well. Can you tell us a little bit about yourself and what you do?
Sure. Yeah. Thanks, Megan. Yes, I am a primary care physician. I started my med school back in Philadelphia and then went to Tulsa, Oklahoma for residency. And then before I even graduated residency, had aggressively bought a primary care practice in Western Pennsylvania. And that was back in 2005. And I've been managing that since. With lots of ups and downs and challenges, and it's been a great thing to do. And I just love being in primary care and also being an independent physician. One of the best decisions I made was back in 2007 when we started our EHR search and we joined up with MedEnt. And so since 2007, I've had that as our electronic health record. And I'm thankful to God that He allowed MedEnt to continue to succeed all these years and continue to rise to the top as being one of the best electronic health records to be a part of. So that's where I am at today, and that's my background. I've got two. Our current family practice has another physician that's with me, and we have three mid-level providers. We are just about to build our new office. We're tripling our size in our physical space. I do a lot of long-term care as well. I do not do internal medicine or inpatient medicine anymore. But that's my background.
Wow. Well, fantastic.
Yeah,
We are so excited to hear about your expansion and growth
yeah,
and we always love hearing about how MedEnt has helped practices over the years. And wow, coming up on 20 years almost with MedEnt.
that's right. That's why
That's amazing.
it is
Wow.
amazing.
What a milestone. So yeah, since you've been with us since the beginning, can
Yeah,
you
I'm the only doctor I know that hasn't had to switch EMRs during that time of the
that's
20 years.
that's incredible. That is amazing. And we are so happy to hear that. Can you tell us a little bit about what's changed over the years? I mean, gosh, from when you started, back in 2005 and started with Meta in 2007, just kind of tell us a little bit about that journey.
Sure. I mean, that's it's been a good one, really. We got onboarded then, and it really has been a seamless transition as the progress of MedDen takes place. I usually don't know when an update's happening, other than I turn my computer on and there's a bar that goes across and there's new features, and they just
Yes.
and I'm like, oh, what does that button do? And there's another added feature there, and it's been very seamless and easy to use, and so there's it's just that we just our whole practice loves MedDent because they it's so adaptable to each user, as well as very functional and efficient, and it saved time. The most recent thing that update that I'm really enjoying is the Suki app, and the
Oh,
Suki is the
fantastic.
AI. Yeah, I'm not. I'm sure you guys are excited about launching that recently, and I'm the sole provider in our group that is using that, and it's been great. Been on it for 2 months now, and I'm able to just push my Suki app. It listens to my full visit and is able to generate a medical note that places everything into place: the chief complaint, the history and present illness. It does all my review of systems in order. It establishes even my exam, and then my favorite part is that it suggests the assessments, and it also adds my plan to the diagnosis codes that they have given me the option, and all I have to do is agree to those, and then my note is completed. And so
Yeah,
it's been
it's
it's been
pretty
fantastic.
amazing.
It really
what
is.
what it can do. And Terry, that brings me to an exciting topic that I'm sure will be one of many covered at Thrive this year. AI is kind of that big buzzword, and I know MedEnt will have some breakout sessions going on at this event. Can you tell us a little bit about what we can expect this year? Are there other hot topics that will be covered? Kind of what's changed in the past year?
Yes. So even the topic that you brought up for the podcast, I mean, optimization. How can we really drive operational efficiencies within MedEnt or another EHR even? And what are the tools that are out and who are the best? It's really hard to decipher when you're a really busy practice sometimes and get sales calls all day long with, I'm the new AI, I'm the new AI. And I think, we've really gone through with a fine tooth comb, and MedEnt's really done their homework to bring us only the best of the best solutions, as, Dr. Gardner suggested. I think the breakout sessions are also in, MedEnt's such a robust tool and has so many reports that can be run and things like that. Let's hear from practice managers from really successful practices.
Right.
What helps you run a great practice and
Hmm.
what reports do you
Exactly.
need to run. For the first time ever this year, we're having on the Saturday. So Thrive is a Friday and a Saturday. Friday, May 16th, and then Saturday, May 17th. The 17th is physicians. That's when the majority of our physicians come. Everybody's welcome on Friday. It's more practice management topics. But for the first time this year on the physician day, we're extending the afternoon for a physician meta optimization session, which is how can we save the
Wonderful.
physicians time, get the physicians what they need? So we're really excited to add that this year.
That's fantastic. And yeah, as you said, I mean, it can get overwhelming with all of the changes that happen, year after year. Um, and it can be a little overwhelming, which we at MedEd acknowledge, when we have so many features. And we want to make sure that our users are using MedEd to the best that they can. We want to improve workflows and optimize, that workflow so that way we can reduce that burden and make you as efficient as possible. So I think this is a fantastic opportunity every year to have these breakout sessions and just highlight, what are the exciting new features we have, and let's talk about best practice. And, Dr. Gardner, I'm interested to talk to you about, can you tell us a little bit about the significance of Thrive from a physician's perspective? What's
Uh,
the opportunity like?
Absolutely. It's last year was just a phenomenal conference. I learned so much. It was the interaction between and the collaboration that took place between us as physicians, but particularly what I enjoyed was that first day of the conference where my office administrator as well as one of my supervisors were able to participate in hearing from other independent offices and also very skilled leaders in office management, practice management, and they came away with a host of new ideas that they implemented when they got back to our practice after the conference, and that was phenomenal. So Terri, I just tell you what, you do a great job. You do a really good job in organization and being able to bring this large group of people together. And I'm thrilled to be a part of this Thrive conference this year. And I'm really looking forward to even further collaboration with the other independent physicians. That's what I also realized there. Last year, I walked away. I had no idea there was going to be so many vendors and other people interested in us as independent physicians and independent practices. So I was able to save a ton of money thanks to Terri on different things that I was spending way too much money on. I had no idea. So that really, the financially, that I just walked away with a big smile on my face because I had no idea that there was cheaper options for better and with better resources. So thank you, Terri. I don't know if I've
Oh,
thanked you from last year.
thank you, Dr. Gardner. I mean, it's really, you know, tough sometimes to, like I said earlier, with even the technologies, just decipher with vendors like professional liability insurance, different vendors for your 401k for employees and health
Yeah,
insurance and things like that.
right.
And we really have worked since, really 2016 is when I started and just developing this sort of Rolodex of the best
Hmm.
with no geographical bounds, which is what I
Right.
love. So we would like to encourage this year as well, not only regional physicians to Pittsburgh, but we would love med-ed physicians from all over the country and
Right.
different practices to join us this year. We'd love to hear what you guys are doing too. So
Yeah.
you're definitely invited.
Well, yeah. Thank you.
Absolutely,
So
yeah.
that the Thrive conference last year was just terrific, and the uh, the the other like-minded medical providers and physician leaders in independent medicine in Western Pennsylvania, I had no idea what neat people they were, just from a character standpoint, but what they were accomplishing in such an efficient way was very inspiring. So I
Yeah.
really enjoyed that time. I'm looking forward to it again. And I have to mention this, Megan. Jason Hobbs is quite a guy. I'll tell you what, he's been at this management for quite a few years. In fact, over 10 years ago, he assisted me with some office management challenges with credentialing and other things that his company, Focus MD, specializes in. And since then, we've been rubbing shoulders, and he's really helped my practice to grow and be
Oh,
successful to
that's
where it
great.
is now.
Yeah,
Thank you
Focus
I'm so,
MD, yeah.
I
One
was
of
going to
our
say,
one of our partners, with Focus
yes.
MD, we always nothing but good things to say about Focus MD and Jason and Terry. You've helped so many Meta clients over the years, and we are just excited to continue to expand that partnership and be a part of this event. So, thank you, Terry, again for letting Meta, just be a part of this.
Hmm.
Thank you.
And Dr. Gardner, that brings me to one of my last questions here is just what are you hoping to take away from Thrive this year?
Well, I look forward to meeting new people that are coming. I've heard through the grapevine of some other physicians that are excited to join us that weren't able to last year. So I'm looking forward to time with them, but also improving and, like Terri said, the optimization of the resources we have, and particularly with MedNet. I'm thrilled how MedNet continues to succeed. And what I'm still, as much as I'm familiar with MedNet, almost 20 years now, I'm still learning that I'm only using maybe 60% of the capability of the software, and so I'm hoping to increase that and become a leader of and I think at the conference, some of the MedNet super users or super teachers, particularly like Ed, and Ed is somebody I'm looking forward to spending time with at this conference and having him show us some ways to further improve how we use the MedNet resource.
Yeah,
So the
and
other thing,
for those listeners who don't know, that's Ed Regis. He
yes,
will
thank you,
be
Rodriguez.
Yes,
Yes,
he is one of our super users. He's fantastic. He's been with Medit since the very beginning.
yes.
And so yeah, I don't mean to date you, Ed, if you're listening here, but but yeah, he's been with us from the start, and we are thrilled that he will be joining the conference again this year to help users learn how to best use Medit.
That's right. I usually don't have to say Ed's last name when I'm talking about Medent because everybody knows Ed. He's like
I
the
know, just
the
about
best
everyone
guy in the
does.
world. So yes, Ed Regis, and I look forward to seeing him and a lot of my other colleagues, like Brian Lieb. Boy, that guy is tremendous. I can't wait to hear what he has to share at the conference. Dr. Bonarati, he's a neurosurgeon that's I believe he's attending this conference, and boy, he really inspired me last year as well with his just the way that he operated things. So he was great. So there's people like that I'm looking forward to spending time with, and taking home with me even more than I learned last year. So that's what I'm looking forward to.
Fantastic. And Terry, is there anything you wanted to add about the event this year? I know you did say that, we're hoping that more people join, not just regional. We're kind of taking off those geographic, boundaries and welcoming as many, physicians from all over, and practice administrators, I should say. So Terry, is there anything else you wanted to add about this year's event?
There's just that there's a focus. I know we've said the word a few times, and Dr. Gardner definitely touched on it. Optimization, is really the word of the year. How to really optimize MedEnt and, like I said, even other EHRs. And we have some specialists, and as Dr. Gardner pointed out, super users who will be there that have actually even started their own companies spawned off of working with MedEnt for 20 plus years to be able to jump in and really help somebody one on one with how to set up MedEnt from the beginning with, all these tools that they can help the practice be successful. So we did not have that last year. I think, it was being the first year, we were just kind of seeing what happened. Some of the, MedEnt owner Barb was there, as well as Ed. And this year, I think we're going to have a whole crew. So we're really excited to invite everyone to Pittsburgh. We're going to have, the best food and, just really excited for everyone who's going to join us this year.
Yeah.
Absolutely. So yeah, we're
Megan,
so
if
excited.
I would just want, I'd like to make another comment too. I just Barb has been so wonderful to work with,
Oh,
and
wonderful.
she's the personal touch that she puts onto MedDent has been really special, especially with the Suki app. She's reached out to me personally to make sure things are going smoothly, and she's very invested in making this take MedDent to the next level.
Oh, absolutely. And she, I love working with Barb. That's Barbara Cuthbert. She's one of the best here at Medin, and we do,
Mhm.
pride ourselves on that personal touch. We always like to get in touch with our clients and just make sure everything's working smoothly. And we have our Gold Star support team here for when things you might need some extra help. But we are so excited to focus on that optimization this year and let people know about best practice and hear how physicians and practice administrators are using MedEnt. We love the feedback. Not to sound too punny, but we do thrive on that. So, we're looking forward to hearing from physicians and practice administrators on how they're using MedEnt and how we can improve and just collaborating. To kind of make this the best experience for all of us. So thank you so much for joining us today. We're thrilled to have you on, Dr. Gardner. I can't wait to have you join us again sometime. And
Yeah, I'd love to.
Terry, it's always a pleasure. So yeah, thanks again, and we look forward to thriving again this year in just a couple months.
All right.
Sounds
Thanks,
great.
Megan. Really
Thanks,
appreciate
All
it.
Megan.
right, thank you both, and take care. Have a great day.
Yeah, you too. Bye
You
bye.
too. Bye bye,
Bye.
everyone.